tonight's workshop on heart disease, you know, it kind of seems like we really should be doing a measles workshop right now. If we maybe just tweet out, hey, we changed the topic to measles and the room will be full in like 15 minutes. You know, but of course it is. I'm sure the American Heart Association is having a fit because isn't this Heart Association or Heart Attack Awareness Month? Yeah. Oh, they are probably having a fit right now because they're not getting their media time. No, not pink.
That was red.
Red. Yeah.
Like a red.
Yeah. I haven't seen any red ribbons or anything.
Rebrand the whole thing.
Yeah.
Okay, I want to know, because I heard on the news, okay, only 100 people got the measles, right? How are parents throwing measles party?
It's now 120.
120.
Oh my. Epidemic.
Global proportions.
I just want to know where they're getting the kids for these measles.
Yeah, you got
They're
to
saying
have
the
to
CDC says parents don't throw measles parties. I go,
Yeah.
there's not enough people to go.
You gotta find somebody with a measles party or else it doesn't work.
It doesn't work.
I think they said the closest state to Alabama is Texas right now.
Thank God.
Yeah.
Thank God. Texas is a long ways away. I mean, no poking fun intended at it. I mean, obviously, you know, I'm not, you know, nobody is going to poke fun even if your child has a cold. The only thing anybody is really having an issue with is the hype. The overhype that it's getting is just, it's unjustified. It's insane is the only way to put it. You know, you know, you look at the fact of there's probably more dog bites in this time frame than there were. Why aren't people having a fit about rabid dogs? Like, you know, because they are the rabid dogs. I mean, it's all about. Unfortunately, it's all about sales. So, you know, I mean, we just gotta keep waking people up. But anyways, back onto the actual topic because we're not going to talk about measles all night. I'm kind of tired of talking about it. The heart disease, we're going to be covering just the foundational basics, and this is actually going to go pretty quickly because really this is almost one of the easiest topics to tackle. Because there's just some very key foundational principles. At the end of the day, the whole thing is metabolic syndrome. So you can really wrap up heart disease, diabetes, cancer, you know, I mean, even chronic fatigue syndrome. A lot of these things you can wrap up into the same box because obesity, they're all the same thing. It's metabolic syndrome. So we're going to be talking about what are the fixes for that is going to be the target. So getting into it, drugs gone wild. Of course, you guys know statin use has dramatically increased in usage over the last few decades. I mean, it's gone up just a tremendous amount. You can see the percentage of men and women that are taking the medications where it was from 1988 to 1994, then 1999 to 2002, and then 2005 to 2008. And you see now, as of 2005 to 2008, nearly half of those over 75 years old are taking it, and from 65 to 74, it is half. It's 50%. You know, so half of people are taking statin medications. They're pretty popular. Okay. You look at what's happened in the trends of actual cholesterol. The people having total high cholesterol above 240, even though that number has, you know, consistently been brought down by the drug companies. You know, they just keep on lowering the standard. You know, well, you know, think about that. Okay, at first they set high at whatever it was. Let's say it was 300. I don't even remember at this point, but they set it at this level here, and only so many people qualify, right? They only so many people fall underneath that level where they're in the umbrella where they need statins. So you've got a good selling drug. How do you make it better? You lower the standard. So they lobby to get it lowered down to 280. Now you bring in a whole host of other people, right? So where you had a group that was this small, now that group is this big. It doesn't go up it doesn't go up in equal amounts, it goes up proportionally. The closer you get to what could be considered a normal level, the bigger the pool gets exponentially. It literally goes like this because more people are going to fall into that territory. Does that make sense? So they want to get that number as low as possible because now you can incorporate, well, literally 50% of the population. But as we see these trends go down, or as the drugs go up, we do see that the high total cholesterol is going down. Nobody can argue that, right? So total cholesterol among adults has steadily declined with increasing usage. The research is clear, right? Nobody's arguing that the statins don't work. While your brain represents about 2 to 3% of your total body weight, okay, 25% of the cholesterol in your body is actually found in your brain. Okay? So where it plays an important role in, get this, membrane function, okay? What do you know about the membranes of cells? Have we talked about this before? If you look at the cell as your whole body and you make the translation of, this is how your whole body operates, this is how your cell operates, what organ does a cell membrane represent?
Skin.
We would think, right? The brain, the nervous system, right? Because the cell membrane controls all intracellular and extracellular communications. In other words, the cell membrane is where all the senses of the cell lie. It controls all functions internally and externally. We used to be told that the nucleus actually controlled cellular function, right? You remember learning that in school? Completely wrong. You know what this is actually kind of funny. You know what the nucleus represents? Sexual organs. It's merely where the DNA is stored. It's there for replication, right?
Yeah.
So the DNA actually splits off, the nucleus splits, and that's how it transfers DNA to other new cells. So it's nothing more than the gonads. But the cell membrane is actually where all the magic happens. That's where everything transfers inside the cells. So when you don't have cholesterol, you don't have proper membrane function, which means the nerve system of your cells are not operational. So how can your cells operate? They can't. So how well can you expect somebody on cholesterol medications to operate? They can't. It doesn't matter even if from a chiropractic perspective, if your nerve system of your cells is not operational, we talk about this with omega fatty acids. If it's not operational, then how can I get your macro nerve system to operate properly? Make sense? We got to work on the micro level before we can really, expect the macro level to be working in full as well. So, membrane function, pretty important. Acts as an antioxidant. What do you see happening now in the research with cholesterol medications? Causing, you guys have you heard this? Cholesterol medications, there's now a correlation between taking cholesterol medications. Basically, a lot of doctors call it cancer fertilizer. Heart blood pressure medications too, they call it cancer fertilizer because of the roles that it plays. And we'll go through that one when we get to the blood pressure meds.
Same with diabetes.
Same thing with diabetes, yep. The cholesterol medications increase risk of type 2 diabetes in women by 50%, I believe. Yeah. Now, going on, it serves as raw material. This gets wild here. Tie this into all the previous workshops if you guys have seen them. Serves as raw material from which we are able to make things like progesterone and estrogen. What are those? Hormones for women. How many women above the age of 50 have their hormones all over the place?
Not even, try like 35.
Try like 35, yeah, it's getting worse. But we know that 50% of women are now taking cholesterol medications. Cortisol, that is the stress hormone. Okay, you can't produce that. Testosterone. What's happened with sexual dysfunction in men? You look at people having, I know you weren't raising your hand for that. So testosterone, that's on the downfall. Dr. Mike, you're actually going to be teaching a workshop on this. Living La Vida Loca is coming up is it next month?
Next month.
Next month, perfect. Okay, so this is going to be tying right into that. And then the big one here, vitamin D. You can't produce vitamin D. What are we seeing happen with people's vitamin D levels? Tanked. And from previous workshops how that ties into cancer and everything too. So this is according to David Perlmutter. He's a MD. I think he's a neurosurgeon.
Cardiologist.
Okay, so moving on. Yes, they do lower cholesterol. Okay? However, no studies have shown statin drugs to be effective for women of any age, nor for men 69 years or older who do not already have heart disease or diabetes. Better than 50 adults have to take a drug for just one patient to avoid a mortal heart attack, and that figure only applies to high-risk patients. There is a vanishing benefit to lowering cholesterol for healthy adults. But then you look, and the NIH, the National Institute of Health, their public access website admits in the elderly, the best memory function was observed in those with the highest levels of cholesterol. The highest levels of cholesterol. Low cholesterol is associated with an increased risk for depression and even death. This is from the NIH. I mean, they have this information readily. What do we see happening? Alzheimer's, Parkinson's, and dementia are going through the roof. Because we're going back on this giant house of cards that is crumbling day by day, research article by research article. The whole thing is collapsing because of faulty research that was called out long ago. I mean, this stuff has not, it should not have survived this long, but as long as you're making money, you'll find ways to perpetuate it, right? You know, and that's unfortunately what is exactly happening here. The leading cause of death in the U.S. Cancer, 574,000 people. Heart disease, 597,000 people. Death by medicine, however, is 783,000 people. So we're told, when you look at the numbers, this comes from a report called Death by Medicine, rightly named. We're told that, you know, heart disease is number one, cancer is number two, but the reality when you pool all the numbers together is that medicine, healthcare itself is actually the number one leading cause of death in the United States. In fact, we kill more people every year because of healthcare than all the soldiers in the United States that have ever lost their life in military conflict in the entire history of the United States. And we do that every single year. Okay? Now, how do they hide that data? It's because we separate it out, right? If you have one big chunk that's attributed, but you can chunk it out into little pieces, it's easier to hide, right? Anybody ever have kids? Yeah, did they ever try to hide anything from you by separating it into many parts and hiding them in different places? Yeah, it's child's play. So, but when you put all of it together, you get this stunning total: 783,000. 106,000 of those are adverse drug reactions, and that happens every single year. Yet, do you see them on TV harping about 106,000 people dying because of medications prescribed to them, and saying that we need to officially end the use of prescription medications? Oh no! Instead, you would hear the exact opposite. But how many lives have been saved? There's always an answer. There's always some kind of a throwback answer that's going to come in over and over again. Marijuana, why do I throw that up there? It's simple, because it's illegal, right? Marijuana's been made illegal. I don't do it. I don't know if you guys do it. If you do, you know, whatever. It's illegal still, but honestly, I'm not going to tell you you're going to die from it, because I don't know anybody that has ever died from it. Do you? I mean, I guess if you operated a car or something, or a forklift, you might stand a chance. But most of the people that I know that have, they're pretty mellow people. Yeah.
You know, and I know you were just talking about the with medicine. Just thinking about that number comes out to be 2,000 people a day. Mm-hmm. And just thinking of the recent hysteria with just other stuff, if 2,000 people a day were dying from whatever disease we wanted to say, just how outrageous it would be. And to think 2,000 people a day are dying from medicine.
Yeah. That's more than a fully loaded jumbo jet. A fully loaded 747.
In the U.S.
So if a 747 crashed and killed everybody on board every single day, how long do you think that would take before we grounded the aircraft?
Not very long.
3 days? 4 days? I mean, it wouldn't take long. But that's unfortunately what we live with. So, indeed, epidemiological data indicate that in general, population marijuana use is not associated with increased mortality. So they know there's not a risk of death with it, yet it's illegal. And we got to ask, well, why is that illegal? Yet all these other prescription medications, like for instance Tylenol, Tylenol is the leading cause of acute kidney failure. Benadryl kills 800 people a year. Vaccinations. According to the VAERS database, just the measles one, we know 108 people so far have died from the vaccination. You know, the autism rate now in this country, which they say there's no correlation, but there is correlation. There's multiple studies that show direct correlation. There was an MIT study that showed that they could actually replicate the mechanism of how autism happens when they combined the aluminum in the vaccinations with Tylenol use. Why is it tied to the MMR vaccine? Because that's the one with the side effects of high fever. What do doctors tell the parent to do? Go home and take Tylenol. So it's a combination of the aluminum. It shuts off their, I believe they said it's the sulfur mechanism. It depletes the brain of sulfur. And then they throw in Tylenol on top of that, which further depletes it. And the child goes into a tailspin that they never recover from. The brain can't handle it. So the mechanisms are there, but they just say that they're not there. That was an opportune moment. So, hey, look at that. So we just covered measles. You know, but we just don't talk about those things because it's not relevant to the money model that's in play. That's really what all this comes down to is American medicine. It's a healthcare profit machine. Unfortunately, you know, I mean that may sound like I know to people that sounds like it's, you know, some kind of like conspiracy theory or something like that. But reality is reality. It's just numbers. I mean, when doctors themselves say on the cover of magazines that the scariest thing for a doctor is being the patient, what does that tell you? When oncologists tell you that, you know, when 95% of oncologists tell you that they would not do the same treatment for their families as they do their patients, what does that tell you? You know, I mean, it's just, we got to start looking at this and seeing this has got to end the way that we're going about our problems. So let's look at a little bit more logical approach. How's it working? With all these medications and pouring this in over the decades, we have more heart disease, 75 million. We now have more obesity, we have more cancer, we have even more medications to cover up these things, more surgeries. It's working absolutely great from a medical standpoint. For the machine, it's going great. It's going wonderful. In fact, business has never been better. Unfortunately, we're the ones that are losing our lives over it. It's, you almost have to argue it's effective population management, you know, because it's that effective. So I love this picture, how the world sees America during the Olympics and then any other time. That's pretty much exactly it. I was over when I was over for the Olympics, I actually made a point to ask random people that I met, so what do you think of America? And, you know, or Americans in general. And it was funny because I got to be like the NBC representative while I was there, and so I was actually doing interviews of people. And, you know, so what do you think of Americans? And on camera, they're like, oh, we love you guys. You know, everybody's so friendly and blah, blah, blah. But then off the camera, what is wrong? Like, why do you guys take so many drugs? Why, you know, you at first it'd be like, well, you know, what do you mean? I say, specifically, I'm a doctor. What do you think of Americans in terms of health? And all of a sudden they'd just be like, you guys are messed up. Like, you guys take way too many drugs. Obesity is rampant everywhere. Your children are sick. I mean, it's just all this stuff. They know it. They see it. So, you know, unfortunately, that is absolutely true. So what is the cause, the actual cause? Because if you want to find the cure, you have to understand what the actual cause is behind it, so you know what to fix. So the cause is, of course, inflammation. High blood pressure is necessary, and here's why. If you look at this here, okay, this is what a normal artery is supposed to look like. And if you understand the cross-section of an artery, you know that's muscle. Okay, there's actually muscles in that artery, and that's how everything contracts and relaxes to regulate blood pressure and to keep everything moving through. And you have all this interstitial tissue, all these different components. They work together, but they're cells at the end of the day. It's not a rubber tube that passes through your body. This is living tissue. Okay, well, all living tissue works similar in terms of inflammation and not inflamed. So when you have a normal artery moving through the body, okay, you've got this nice open channel in through the middle here, and that's what you're seeing there. Now, as you develop inflammation, you don't just inflame outwards, Okay, you inflame inward as well. And that's what we're not really considering here. So this artery doesn't just blow up, it blows in. And so when you do that, you cut off the space that you have blood to be able to pass through. Okay, think about it in terms of, who in here knows somebody that's had a stint? Everybody, right? Okay, so you go in and you get a stint done because they say we need to open it up. You know, we need to get everything moving again. Okay, can you see why we need to get things moving again? Okay, but unfortunately, what happens when you go to a doctor? Do they have a fancy test where they open you up and they look at a cross section of an arterial wall to see how much inflammation is in that vessel? No. That might be valuable, don't you think? Okay, what do we do instead? You go to your doctor, what happens?
You did a stress test.
You do a stress test. What's the most simple thing that they do though? The starting point. You're a young guy, 38 years old, not morbidly obese, just slightly overweight, but they want to check the function of your heart. What do?
Blood pressure.
Blood pressure, right? They put a cuff on your arm and they check your blood pressure. Your blood pressure is 20 points too high. What happens?
It's like a pill on the first thing.
Blood pressure medications. We need to put you on blood pressure medications. Now, understanding that, you look as this artery continues to inflame, you end up getting to just totally occluded arteries where you cannot push anything through. An aneurysm is where there's so much back pressure trying to push through there that the artery actually blows out. And that is an ambulatory issue. That is something that, as chiropractors, we have to watch for. We look at those lateral lumbar x-rays and we look and see if there is an aneurysm on there. Usually there'll be all kinds of plaque buildup around it because the patient has been dealing with this problem for so long, just taking drugs to try and fix it. But think about this. This is why it's so important. That's what it's supposed to go through. And what does the artery do? What do they actually do? What's the point?
Carry oxygen to the cells.
Carry oxygen in cells. Okay, so your heart sits here and it takes the blood, from your lungs that now is enriched with oxygen and it has to push it through, let's say, down your leg, down so that your foot can be healthy, or your anus or whatever. I mean, any part of your body, it's got to get blood in order to function properly and to keep the cells healthy. Because what happens when you don't have proper oxygen supply to cells? They die, they deteriorate, they also become cancerous. Okay, so keep that in mind. So we've got point A that's got to get blood over to point B. And you have a channel that has to run that through. And it's only so big. So the pressure, in order to regulate the amount of, if you've ever pumped gas into your car or run a garden hose, you understand how this works. In order to get a certain amount of gallons per minute, to fuel this over here, whatever the requirement is, you take that measurement, you have to regulate the pressure accordingly. If you tie a garden hose to a fire hydrant, are you going to want to water your garden? No, you're going to be blowing stuff out of the ground, right? Probably killing yourself too. So you don't want, you've got to regulate the pressure there. So if you take that now and you replace the garden hose with something the size of a straw, but you still have the same demand on the other end, what do you have to do? Increase the pressure. You see how that works? So it works because when you cut down the artery size because of the inflammation, that internal opening closes down, you must increase the pressure in order to get the same amount of blood flow through to the receiving organs. Otherwise, you starve them of oxygen. So you get put on a blood pressure medication and it starts to lower down your blood pressure. What does your body immediately do in response to it? It tries to kick it back up, right? So anybody ever heard of anybody that's been on blood pressure medication, a small dose first, and then they keep on getting it jacked up higher and higher and higher because it's not working anymore. And now they're on 2 blood pressure medications, and then 3, and then 4, and then they die of a heart attack. Anybody ever know anybody like that? Yeah, we probably all do, because it's the same story. And the whole reason why is nobody ever dealt with the inflammation. In fact, the drugs actually cause even more inflammation, so you're making the problem advance even further. You see how that works? So you can see, is this not crazy? Dealing with it that way. It's insane. You know, when the science is there, there's no excuse why we should continue to do this. You know what the best excuse is? Well, I mean, this is, I hate even repeating this, but this is the best excuse I've ever heard a medical doctor give for giving patients medications for this. Because a patient won't do what I tell them to anyways. That's the best excuse I've ever heard him say. I mean, that's the only one that really makes sense. You know, because the patient won't tell them what to do anyway, so I guess if that's the only thing you can do. But honestly, who has ever been explained this before putting them on medications?
No, it's always plaque. Plaque is built
Yeah.
up, the evil plaque, which is your cholesterol, and that's the cause, not inflammation.
Yeah. Unbelievable.
But there are some that would rather just take a pill to do anything.
Yep.
Like, so-
Well, it sounds like an easy answer.
We don't have to change anything.
Yeah, you got a choice. You got, you know, here you go. You can follow this diet, you can exercise, you know, an hour a day, you can do this, you can do that, you can restrict everything that you love to do, or take this little pill. Which one sounds better? You know, I mean, it's
In the short run, it's like that.
you got the easiest sales position on the planet, drug companies do. They really do. So what causes inflammation? We already covered that, but it's sugar. Sugar is what actually causes the inflammation. It's the primary driving force. Do you see why our diet, what's the first thing that you cut? Sugar. Who in here is on the advanced diet?
I'm trying.
Yeah? You guys sticking to it? Yeah? Very good. Have you seen results so far taking it? Good pat on the shoulder there. Little bit? Little bit is where it starts. You got to go through a little bit before you get to a lot. Every time.
Put sugar and everything.
Yeah. Okay. Bad fats cause inflammation. What do we mean by bad fats? Go.
Butter.
Butter.
Just kidding.
I'm gonna throw a Healthy Living magazine at you. Yeah. He knows. Margarine, canola oil, pork fat, vegetable oil. You know, all those kind of things. Those are all bad fats. Coconut oil. Just joking. No, that's a good one. Yeah, it's good for you. Okay, so bad fats cause inflammation. Let me give you an example of this, just real quickly, just to see how this stuff really works. You know, just wondering, do you really know what you're eating? We went to Ruby Tuesdays one time. Sorry, Ruby Tuesdays. But we went there one time, and my wife went to the salad bar, and she got her salad because they actually use organic field greens and stuff. I mean, we actually like their salad bar. It's good. And I used to work there when I was in high school. That was my third job ever working there. I was the salad bar attendant at Ruby Tuesdays. So anyhow, she went up and she got her salad and everything, and then they didn't have any olive oil left up there. You know how they always have the olive oil and the balsamic vinegar, and that's what she always gets. So she said, do you guys have any olive oil? And so they went back to the back and they got her some olive oil, and they brought it out to the table in a little metal ramekin cup. And so she put some on her salad, Jalen put some on his salad, and then I was like, well, you know, I'll just use a little bit. There wasn't much left, you know, so I took a little bit and I put it on my salad. And they're sitting there eating their salads, and I put one in my mouth. I mean, it barely even hit my mouth, and I mean, shot it all over the table. I said, stop eating right now. That is not olive oil. I don't know what that is, but it is not olive oil. And so I put my finger into the little cup of the straight up oil, and I tasted it, and it immediately started burning my tongue. I mean, it was literally, it tasted like a chemical. I said, stop eating right now. That is a chemical. That is not olive oil. We need to find out what that is, because I need to know if we need to go to poison control or something. I had no idea what they gave us. So they went back to the back, and she talked to somebody, and you know, she was gone for 10 minutes, and then she comes back down and she says, I'm so sorry. I actually meant to give you olive oil. I didn't realize it was the soybean oil that we fry everything in.
Ooh.
And at first I'm relieved because it's not a chemical. You know, she didn't feed me turpentine or something. But then I'm like, that stuff burnt my tongue. Like literally the second that I touched it to my tongue, it burnt like I mean, that is not food. And yet that's what they're frying everybody's food in. Think about that story the next time that you go to eat a French fry or a fried chicken finger or something like that. I mean, that's why we don't touch anything that's fried anymore, because I know where it's actually coming from. That is the kind of stuff we're talking about. I mean, that wasn't even an oil. I don't know what, I mean, it tastes like gasoline. It literally, you probably could have lit it. I mean, it was bad. Chemicals, including medications, also cause inflammation. So any kind of chemical in the body causes inflammation.
How
Okay?
about like the processed food, when you read the label, the paragraph, and it had all those things you can't pronounce? Are you speaking of those?
Yeah, food preservatives, all that stuff. Anything that, look at it this way, anything that is not food causes inflammation. Realistically, when you put anything in your mouth, I mean, just like if you, if you remember those little jacks, used to be toys that kids played with, probably some of you guys did, you eat a jack, it's going to cause some inflammation. Might not be until it's about to come out, but it's going to cause inflammation, right? So that's not food, but chemicals do the same thing. If it's not food, it's causing inflammation somewhere in the system. So if we don't address that, you can see we're going to carry on that problem. So the cause is the cure, literally. I mean, it's just that simple. If you remove those things from your diet, then of course you're not driving inflammation. So that's why when you look at our diet, it's got no sugar. It removes all the bad fats. It increases the good fats. It removes chemicals. It removes the things that you're not supposed to eat and tells you exactly what you can eat, so there's no questions about it. When you do that, the inflammation just comes crashing down. So as the inflammation crashes down, your blood pressure regulates, your cholesterol numbers start dropping, your blood sugar regulates, people start losing weight, they start feeling better, their energy increases, their hormones start to balance out. I mean, everything else happens simply because you're getting what your body is actually supposed to run off of.
You want to go over the modality real quick on, we talked about the blood pressure, inflammation, and causes the increased pressure. So we see how blood pressure. What's the modality? Why does your cholesterol numbers also rise in that same?
Good point. You got to understand what cholesterol is. Cholesterol is plaque. Okay, it's not plaque. Think of it like spackle. Okay, I always like to reference people when they're trying to spackle a wall. So if I come over and I had a pocket knife and I came over here and I just gouged into the wall, okay, I would have to go and I'd have to repair that hole somehow. So I go to the closet and I get some spackle and I go out there and I smooth it over. Okay, and it works just fine when you only have a little nick in the wall once in a while, right? But have you ever gone in after a demolition crew and tried to spackle a wall? It's not going to work. You're going to, and what if you just repeatedly try it over and over and over again, right? Every time you spackle over a hole, you've got terrorist little children, and they go and they kick in the wall again, and they're gouging stuff all over the place, and you're constantly trying to fix that wall. What eventually is inevitable? It's going to look a mess. Even though you can see it, you've got easy access to it, it's going to look a mess. It's going to be completely covered with spackle. It's not going to be even. You're going to have massive buildup. And that's what happens. Your body creates cholesterol to repair damage in arteries. And not only that, but of course it's a precursor to all the hormones, like we said, vitamin D and everything else, but that is one of its functions, is it's supposed to go back and repair the arterial walls. It never was intended that we were going to be doing so much damage to our arterial walls by the things that are not supposed to be in our diet, by the chemicals, by the drugs, the bad oils, and everything else. Does that make sense?
Yeah, because I know when I was young, blood pressure was the first thing that started increasing. A few years later, of course, followed up with cholesterol. And you can see the same modality, basically the damage I was doing to the arteries because of diet caused both numbers to jump up, and of course statins and blood pressure medications would follow.
Bingo. Yep.
I heard it put, one doctor, I forget which doctor it was, I heard it put that sugars really act like little tiny shards of glass that go through your arteries and actually cut the arterial wall so the cholesterol then comes in, tries to patch it, and over and over and over and over again. It's just like you said with the wall.
Mm-hmm. One of the other really big ones is conventional dairy, milk products, anything that's homogenized. Because when nature as it intended, the proteins in milk are very large proteins. Okay, they're actually not able to be permeable through the intestinal walls. But when you homogenize the dairy, it breaks it up into smaller fragments. And that's for literally just aesthetics and the different cooking aspects and stuff like that. Like for example, it's easier to microfoam milk for coffee when it's homogenized. Absolutely, it seems easier for whatever reason. But at the end of the day, those proteins now get through your intestinal tract. They actually get through your intestinal walls and they go into your arteries as free-floating proteins. And that debris literally is junk, clutter, moving through and doing the same thing, scarring up your artery walls. So you've got to repair the damage. And so that one more reason why getting off of conventional dairy, especially homogenized conventional dairy, is so important. Okay, so by doing the diet, and this book is literally just a guide that can help you move along. The diet that we give is just a one-page sheet, so you can follow that. But if you need additional, this really has all the complete information on, why you should eat different things, meal suggestions and cooking suggestions, and the difference between coconut oil and butter, and all that different stuff. So it's a good additional study material. But the purpose, reduce inflammation. You need to have a 2-to-1 omega fatty acid ratio. So how many of you guys have started on omega fatty acids? Okay, good. So most people in here are taking fatty acids. You've got to have that ratio. When we test pretty much everybody that comes in on that. That's kind of part of standard protocol. And I'd say the average that we test is probably 10 to 1 to 20 to 1. I mean, somewhere in that range. They say that the average American is about 30 to 1. The average American. I mean, and it's supposed to be 2 to 1. That fatty acid ratio is what makes up the cell membrane. Okay, so you have to have the cell membrane constructed right. Imagine trying to build a house with the wrong proportion of bricks to mortar. You've got like all these bricks and just a little tiny bit of mortar holding it all together. The whole house is going to fall down in the first windstorm that comes along. So you've got to have it built correctly. The advanced diet plan does that. Efficient exercise, doing the surge training. You went through that in the last workshop, right? Yeah. So lose 5 pounds in 7 days. Yeah. You can go back and watch that video and go through the surge training on how to do that. Eliminate toxins both inside and outside. It's not enough to just get rid of, and buy a new shampoo. You've got to get rid of the stuff that's outside. But likewise, if you clean up your diet, but you're still cleaning your house with Lysol and Windex and all this other stuff all over the place, your whole house is building up with toxins constantly. And think about it, that is like your only safe place should be your home. That should be the one place that you can go to escape all the chemicals because, well, besides this place, I mean, we don't use any here, but or Red Bar next door for that matter. But outside of that, everywhere you go, I mean, think about it. Every time you eat at a restaurant, you use a fork, you use a plate, whatever chemicals they just use to wash those in the back, you're putting that stuff in your mouth. I mean, every single time. Every time you go into a public restroom and you hear the little spritzer on the wall, you're breathing that stuff in. All of these different things you're exposed to all the time. The outside air, it goes on and on. So you got to get rid of the toxins. Your brain is your doctor. So you can go weeks without food. You can go days without water. I mean, you have to have water. You have to have hydration. But you can go days without it if you need to. You can go minutes without oxygen. To drive your cells and feed your organs. You can literally last something like 8 minutes. But you can't go 1 second without nerve supply. If you cut your spinal cord, if you sever that connection, 1 second and your organs stop. They stop proper function. Your body cannot operate without the nervous system. So blood pressure decreased equal to taking 2 blood pressure drugs at once. That was actually a chiropractic study. They found that when you get normal nerve system function, it actually regulates the way that your body regulates blood pressure. Because think about it. your body all at once, all of the miles and miles worth of arteries and capillaries throughout your entire body have to be regulated at a very precise level in order to regulate your blood pressure and keep it at a constant. Think about that. So all of them can expand and contract, but it's a well-known statistic that if you take all of the capillary beds in your body and dilate them at the same time, open them up at the same time, you would literally pass out and die almost immediately. So your brain is under control of that process. So if your brain is not active and it doesn't have proper communication to that system, can you see how it can get off balance really easily? And it's constantly having to try to work and adjust to the parts that it can connect to in order to regulate. So we noticed that, and I mean, we see it in practice all the time, but this study also showed, this was from the University of Chicago Medical Center, and ironically, it was actually posted in WebMD. They showed that when you get a chiropractic adjustment, it works better than not one, but 2 blood pressure medications used at the same time to regulate blood pressure, to lower blood pressure. I mean, it's dramatic. If I've had numerous cases where we've had people come in, they've said that their blood pressure is high, and I say, let me show you something. We bring them back, we test their blood pressure. Sure enough, it's high. We come back and adjust them, and then bring them back over there and get it checked again, and it's dropped by like 15, 20, 30 points. I mean, immediately like that, because your brain is now controlling not some, but all of your arterial system and capillary beds in better efficiency. Make sense? Okay. The power that made the body heals the body. You guys know that. Your brain functioned before your heart had its first beat. So your heart would not function, your blood pressure would not operate clearly if it weren't under the influence of the brain, because if your brain never developed first, you would have never had a heartbeat. Okay? It has to operate first. That is the very first organ. If you follow fetal development, it's the first thing that develops inside of that little embryo. The nervous system is the first thing to form. The nervous system controls all function. There's nothing in the body that's not under the direct influence of the central nervous system. Every other organ effectively supports the brain. So think about that one. This is probably the most profound point of human anatomy, is that you don't have a heart to beat blood to your body. You have a heart to beat blood to your brain. That's its first function. Because your brain consumes 75% of the oxygen of your body in the resting state. It's a profound amount. I mean, it's literally consuming massive. It's like a computer. Think about it. Most of the energy drain in a computer is by the central processing unit, not the hard drive, not the memory chips and everything else. They use very small amounts. So your brain is constantly consuming energy in order to go through its functions. So every other organ effectively supports brain. Why do you have legs? Guess why you have legs?
Point A to point B.
Yeah, to walk your brain across the room. What's the point? Why do you have a tongue now? Why do you have a mouth? Why do you have vocal cords? So that you can pick up on your lovely wife, right? You know? So why do you have ears? You know, so they can listen. Is it effective if you didn't have legs for, to have ears that you got to hear from somebody across the room? No, you got to have legs to get you over there. You got to have ears to listen to them. So every other point in your body, but your ears are just sound sensing tools. Your brain has to process it. Do you think your eyes actually see images? No. Your eyes just gather light. Your brain has to organize the data in order to make it an image. So there's a really cool test. You guys can try this later, but certain people, if you close your eyes and you actually pass your hand in front of your head, okay, you can actually see your hand. You can try it right now if you really want to. I won't stop you. But you can actually see your hand because your brain has such a proprioceptive connection to your arm. So proprioception are the sensors in your arm that I'm just joking. It really doesn't work. It does. I'm just messing with you. So your proprioceptors in all of your joints, they constantly are giving feedback to your brain on space and position. So you can tell where your hand is behind you even though you can't see it. Well, that information is so dominant within the brain that you can turn off the input from your eyes or just blindfold yourself and you can still see it. He's going behind the wall to check it. So, you know, you can, your brain works off of all these different devices in order to organize the data so that you can now interpret it. But here's the big picture is your brain is you. Your brain and your nervous system is really you. You can replace every other organ theoretically in the body. You could pull everything else out, but you can't have a brain replacement. You can't have a spinal cord replacement. That is you. Okay?
We wish we could put spinal cords in some people.
Yeah. Replacing. Okay. Can you absorb nutrition effectively without the brain? No way. Do we even have to go into that a whole lot more? No. I mean, if your intestines are not connected to your brain, your intestines don't know what to do on their own. They don't even know what your body needs. How is it that your brain tells your intestines what it needs to absorb and what it needs to push out? Remarkable, right? It's that integrated connection. Can you exercise efficiently without it? No. If you're only functioning at 50% neurological connection to your heart, is it safe to exercise? I'd argue no, right? You're actually better off not stressing it. That's what I think is so funny about the idea of a stress test, right? You know, the cardiac stress test. Let's see if your heart's about to fail by running you on a treadmill. But don't worry, you're in the right place unless you pass out. You know, it's kind of unreal the way that we think about these things. Can you detoxify systemically without it? No. Because your body controls all your cells and tells them where to dump toxins, what needs to dump, where to put them. You know, all these different factors, everything again is controlled by the nervous system. Okay, so what is subluxation? If you look at the normal posture in the body, okay, and if you really want to get into the intricate details on this, go back and watch the workshop, The Science of Spinal Correction, because we go through all of this stuff in detail. But these curves are absolutely critical because, as you can see, they follow a geometric model of a 30, 60, 90 degree triangle. The most stable structure in existence, the body follows it perfectly to a T. It is unreal. So this model represents how the body is conformed to most effectively deal with the force of gravity. Okay? So when you're not in that position, when you don't have 30, 60, 90 degree triangles supporting the structure, you don't absorb the shock of gravity properly. And now you wonder why your knees hurt, why your back hurts, and why your arches are falling, and have plantar fasciitis, and forward head posture, and cramping shoulders, and all these other things because your body isn't effectively doing it. Imagine taking the Hoover Dam and straightening it out. Not a good idea, right? But do you know that the Hoover Dam is, of course, based on 30, 60, 90 degree triangles? Okay? Every stable structure in engineering is all based on the same principles that operate the body. Pretty cool stuff. So what is subluxation? Subluxations block the normal flow of electrical impulse from the brain to the body. So the brain is the power plant. Real simple, you've got the telephone pole, not telephone poles, but the power poles that are running into the sockets in your house. That is essentially the switches. So you can think of subluxation and not subluxation as literally flipping a switch on and off. I'm sure you guys don't need that visual, but the end result is the end organ. That's the light bulb. So as long as the switch is flipped on, electricians get this stuff. Every time an electrician comes in, my visit with them is simple on the first visit. I'm like, okay, so think about your spine as the electrical box in the back. So what happens if I flip a breaker? Lights go off. Okay, that's your organs. That's subluxation. You ready for x-rays? Got it. I mean, it's that simple because it's such an easy, you can go back there and you can see the breakers going to all the different parts of the building. And as long as all those breakers are open, everything is clear. You call an electrician and you say, anybody ever do this? My air conditioner's not working. What do they ask? Did you check the breaker box? It's like, that's always the first thing that they ask. And it's like, whoa, how'd you know that? Right? How'd you know that? I went back there and oh my gosh, the breaker was popped. How did you possibly know it was a breaker? Every chiropractor understands that scenario. It's like, how'd you know that? I didn't. I just moved the bone. Like, you turn the power on. Power's on. It's that simple. So how do you get subluxations? It can be misalignment. Sure, if you have a bone that's completely jacked out of position and is putting pressure on a nerve, that can happen. Anybody that's ever had a severe dislocation knows that is a definite mechanism. Regardless of if the medical institutions want to argue if it exists or not, whatever. You know, we honestly, after 110 years, we don't even care anymore. But misalignment, definitely an easy issue. Disc problems. If you have a disc that is bulging posterior lateral directly onto that nerve root, anybody that has ever had sciatica knows what that feels like and knows that things don't operate correctly in your leg. You know, it gets bad enough you're literally dragging your leg across the floor. You can't walk. Soft tissue inflammation. This is one that isn't talked about a whole lot. But, you know, it's almost like you imagine that, you know, when somebody says that subluxation doesn't exist, that you can't have pressure on a nerve, because they look at a model of the spine and they say, well, look, I mean, the facet is that big. I mean, that's that intervertebral foramen. It's that big and the nerve is only that big. You want to tell me that you can compress that down so low? And I'm like, do you think, honestly, that is actually an open space? Like inside your body, you just have this wide open hole there. Did you know that there's connective tissue in there? You know, so if you have connective tissue inflammation, is it not rational to understand that that soft tissue inflammation is going to pinch down on that nerve? You know, it's not just an open hole. There are not very many open holes in you, you know, except for, you know, your stomach, your intestines, you know, your lungs. Cord stretch. This is one of the biggest ones that we deal with in terms of spinal correction. When you take your curve and you stretch that curve out, you take that, any one of these curves, and you stretch them out. It's like the skin on the back of your hand. It stretches out the cord. So now as you stretch out the cord, you're not causing just neurological tension at the nerve roots, but you're also causing disruption of the spinal cord itself. Therefore, you're affecting anything that's running through that spinal cord. This is probably one of the most dramatic issues in human health today, because so many people deal with forward head posture and the loss of that curve, and nobody knows it, and nobody's doing anything about it. Reduced CSF flow. That goes hand in hand with the reduced cord, with the cord stretch, because when you stretch the cord, it's like, you know, I use a Chinese finger trap to show people how this works. You stretch it out and it collapses in on the inside. Well, that sac is where the cerebrospinal fluid comes through. So if you stretch it out and you collapse it down, you don't get as much cerebrospinal fluid through, which means that you're not getting oxygen and nutrients to your spinal cord. Okay? Or it can be chemically induced as well. Anybody that has ever had mercury poisoning knows that to be true. Anybody that's ever had, you know, mustard gas or cyanide, you know, or something like that, they know that to be true. The body does not operate well underneath chemical stress. Any questions on that? You guys got all that? That's a lot of information.
What does the chemical do for subluxation? What does it actually impact?
Chemically, I mean, literally, it just blocks transmission.
Okay.
You can literally just change the, and there's literally an unlimited number of mechanisms there. I mean, you can, there are chemicals that exist that literally could just stop a neurological impulse. I mean, in fact, we make drugs to do that, right? You know, you can have sedative drugs and everything that just slow down function of, you know, certain parts of the brain. So drugs, or, you know, I mean, the poisons do it too. Even in the animal kingdom, you know, snakes and, you know, and spiders and stuff that work by shutting down nerve function. So the cool part about this, do you know that D.D. Palmer, when chiropractic was very first developed, he actually said, he theorized that there were 3 forms of subluxation: physical, chemical, and mental/emotional. No testing, no science behind it, just common sense. He actually saw it in play and actually wrote down, you know, that these are the mechanisms. And guess what? Now, 130 years later, or however long it's been, when was it, 1895? 1895, yeah, so well over 100 years, 120.
Yeah.
We have now proven that he was exactly right 120 years ago. Talk about being ahead of his time. Unreal. Okay, so when you lose that curve, this video, let's see if it actually plays. Wow, cool. Okay, you see it go from a normal curve, and this is what degeneration looks like over time. This is just such a cool video going through. You see that the first thing that happens is it loses the curve. Now, underneath that stress, the disc spaces start to compress. You see bone spurs begin to form as those bones slide off. You see that bone is sliding forward, so it's creating this bone spur here in compensation, and it just continues to slide. Look at this one sliding off the cliff here. Because there's nothing there, that bone is literally deforming in order to give way to it. I mean, these are just simple, basic laws of physics. You're like, when is it going to stop? So you can see, would anybody look at that and expect that the nervous system is going to be functional? No way. The problem is this, is we look at that and we know that that's a problem, but what do you do about, let's say a new patient comes in, doc, that, instead of having a 35-degree curve, they've got a 20-degree curve, but no degeneration, no bone spur. We look at a case like that, and you can see we might actually get excited about that because they don't look like this. But we have to constantly keep in mind, what's the only difference between that case and this case? Time. It's the only missing factor. So you leave the gravitational forces in places, the laws of physics will take care of the rest. You can't escape the laws of physics. So this will continue to happen, and it's a reproducible, completely understandable, completely predictable process. Spinal degeneration is not a disease. The way that we've been trained that it's a disease, it's not. It's completely and totally predictable, unlike anything else. If you just simply look at the laws of physics, you can calculate exactly what's going to happen well before it ever happens. So it makes us, as chiropractors, soothsayers as well. Not just, we're not just witch doctors, we're soothsayers. So how do you know if you've got this degeneration and, these problems going on? First of all, symptoms. Symptoms are active disease process in the body. And notice that disease is not disease, it's dis-ease. So ease is function, dis-ease is lack of function. So any symptoms, symptoms are not preemptive, right? Have you ever known a preemptive symptom? I got the fever before I got sick. You don't have that. It always comes after, so it's an active disease process. No symptom does not mean no disease. So you can have disease. How many people have known somebody, for example, with cancer, and they've gone in and they've gotten tested for something random and they found out that they had cancer eating them up? Everybody knows somebody like that. So just because they don't have symptoms doesn't mean that they don't have disease. So physical examination, we look at posture analysis, thermal imaging, spinal x-rays, now digital motion x-ray, all these different things can identify these problems before the symptoms occur. Unfortunately, you understand, we've been trained our entire life as a society to think, when do we go to the doctor? When we're sick, that's when we call the doctor, like the Brady Bunch episode, right? Have you called the doctor? It's when you're sick, that's when you call the doctor. But unfortunately, that's the worst time because you're already too late. What really should be happening is we should be practicing preemptive health care, making sure that it's called wellness care, right? To where we're taking care of the problems before they ever occur. And the only way to know that is really to look and see, is there a problem whether you feel it or not? Okay, so what are the next steps? If you're not a patient, leave your contact information, so that somebody can follow up with you. Get a posture scan, at least get a posture scan. We do those at no charge, or the insight scans. I mean, we'll do those at no charge, just to check and see, is there any sign that there is an underlying impending problem. Next obvious thing, schedule spinal x-rays for your entire family, including children if needed. That's kind of, honestly, that's been like a real kick that we've been on here for the last month, is just realizing how many kids that have not been checked, and how many, their parents, we see them all the time, but their kids aren't under care or haven't been or used to be under care, and they haven't been adjusted in years now. And that just, honestly, trust me, we totally get the money thing. That's obvious, and that's with any family, that's going to be the issue. Get that, but outside of that, it's finding that balance to where everybody can get taken care of, simply because I look at my kids and I see how they get to grow up. I see how, my 10-year-old, he's 10 and he just got sick for the first time like 2 weeks ago ever in his life. He experienced sickness. You know, he picked up hand, foot, and mouth from somewhere. And so had it for a week and good to go again. But he's the only one in the family that's ever been sick, you know, of all 3 kids, 10, 6, and 3. So I get to see that. You can see why I get excited about, you know, other kids getting to grow up under that too. I got a message today, you know, about a patient who, you know, their kid has been under care since literally his face was just raw, you know, and just oozing pus all over the place. And finally I asked him about it, you know, and this was years back. He came under care, all the rash cleared up, you know, and he's been dealing with food allergies and just this long, grueling process. But, you know, he just got added 3 more foods into his diet today. You know, and it's just seeing this progress continue. You know, where would that kid have been if he had continued down the medical route? So, you know, I see stuff like that, and you understand why, you know, we're like, we want to make sure that kids are taken care of. Person nutrition plan book, pick up modified diet at the front. You know, one of the at least pick up obviously the modified diet plan, but there is a plan similar in the nutrition book, but it just doesn't cover all the same rules that we cover. And then for specific issues with the, you know, if you have high cholesterol, you notice I didn't give protocols, okay, when we're talking about this stuff, because you understand you really can't. Every individual person is different, and there might be something going on with you that's different from you, you know, so we can't just slap a generic form on everybody and just do this, this, and this. You know, we've got to really figure out what are the probable issues going on there. But some of these supplements that we use, like the nattocerezymes, you know, if we suspect that you've got blood clot issues, you know, and you've got all kinds of debris floating through your system, that stuff is unbelievable at chewing it up. I had a patient that had he had a blood clot on his arm that had been there for, he said, years, like 13 years or something crazy. I mean, it had been there forever. Big, I mean, just hung off his arm. And I put him on the nattocerezymes, and literally within 1 week, it was almost not even palpable. I mean, it just dissolved that thing like crazy. So I know that stuff works. The cholesterol, that's a natural component that you can use to lower your cholesterol. There's lots of other things, red yeast, rice extract, and, you know, all kinds of different things that work for that. But the most effective is don't overproduce cholesterol, which means fix your diet. That's got to be the first fix. So, you know, there's other supplements that you can do to help, but it's got to be an individual basis. The big point tonight was just getting you to understand how the mechanisms work. And then, you know, knowing that those are the points that you got to work on first before you can have the trickle-down effect into the other issues. So do we have any questions? Yep.
The nattocerezymes, is that in any way similar to nattokinase?
Yes, the natto in it, the natto of the nattocerezymes is nattokinase. The one cerezymes comes from silkworms. It's an enzyme that it used to break down the cocoons. Very, very good at breaking down. Yes.
You know, I know you brushed up on cholesterol quite a bit on this. You're doing a cholesterol talk still again this year, specifically on cholesterol, correct?
I don't know.
I think you are.
If I am, I might change it now.
Okay. Will you talk more about the A and B pattern in your cholesterol talk of the LDL particles? Yeah.
You mean now?
No, in your cholesterol talk that you do later on.
If I do a cholesterol talk, we might.
Okay.
But yeah, you know, I mean, all the stuff on good cholesterol, bad cholesterol, all that. It kind of like what drives me nuts about the whole picture is it's a lot of it has come from trying to prop up a broken system. You know, of, you know, the cholesterol, all cholesterol is bad. Got to get off all cholesterol, right? And then they start coming out with different stories that say, wait a second, something's wrong. And so they change the story. And then once something comes out on that, then they change the story again. They just keep on tweaking it. It's like the measles thing. It's exactly the same. I mean, in the report the other night on Friday night that I did, you know, of course brought up the fact that 108 people have died from the measles vaccine reported. Those are just reported deaths that were directly connected to it. Yet 0 deaths from the measles. And yet on the report tonight, they asked the people at the health department about it. Oh, well, they probably had underlying measles. Really? I mean, it's a matter of constantly propping up and finding an answer for everything to try and get around the obvious answers to things. So, so I guess the answer would be maybe. Any other questions? Yeah.
Here's what happened to me. One day I was out of breath. I mean, fast, really got out of breath. So I went to the doctor, immediately put in the hospital, had stents. I did not have high blood pressure. I did not have I know I didn't have inflammation. They didn't even touch on that. I mean, I don't know about that. So I saw what you had to say about inflammation was very good, but cholesterol build up in my arteries. I'm I've changed my diet. Is there anything else that would help keep the buildup of plaque in my arteries?
There's actually research shown that if you, this is fun, you ready for it? If you go on an all vegetarian diet, it will actually completely eliminate plaque in a great number of patients. There's lots of documented research that shows a vegetarian diet will absolutely remove plaque buildup over time. Ready for that? Long term. Yeah, I mean it's not a quick process, but there's doctors that what is that? There was a movie on that. Maybe it was Fat, Sick, and Nearly Dead.
Or Forks Over Knives.
Or Forks Over Knives or something like that. Yeah, there's a couple of doctors in there that had that problem, and yeah, they completely removed all the atherosclerosis through just diet modification, going to a vegetarian diet. Personally, I don't think it's necessary to go to a completely all vegetarian diet. I think it's a matter of eating the right kind of meats. You can't eat corn-fed American beef
We don't.
and reduce the cholesterol levels. It's cows aren't supposed to eat corn. It's got to be grass-fed meats. But when you look at all the China study and stuff like that, they're looking at people who don't have any heart disease, any measurable amounts of heart disease, yet they're eating small amounts of meat. What's the difference? They're domestically raised. They're all meats that are eating their native diets. That's the big key.
In our defense with this problem he now has 10 stents, by the way. This was over the years. But as of about a year ago, he's totally off all his Plavix, his metoprolol, his statin drugs, all these other things were off. We do a very good diet, basically, and also have him on red yeast rice, nattokinase, several different turmeric, several different things that help that. So there are ways, and now his cholesterol is perfect. It's fine.
It's almost always been perfect. My cholesterol has.
It's weird how they can pull the world of people's lives, isn't it?
Yeah. As just an interesting side note on the efficiency of your artery system, even in the midst of plaque. Do you guys remember the story of Dick and Rick Hoyt? You guys ever seen that? It was the father who pushed his cerebral palsy son in Ironmans.
Oh yeah.
You guys remember seeing that? He put his son in a raft and actually swim all those miles dragging his son in a raft. And his son was not a small son. He was a full-grown guy, my size. And then he would put him on the front of the bike, and he would run, pushing him in a like jogger. And he actually ended up dying of a heart attack. Not related to a race, but he died of a heart attack. And when they did the autopsy, they found that his arteries in his heart were like 95% occluded. And yet he had been running marathons, and not just marathons. He'd been running Ironman competitions with 95% occlusion. So, it kind of throws the whole thing on its head, like, wait, what? How is that even possible? But apparently it's possible. And the body functions around it as long as the body is able to healthily adapt.
I worked in construction, climbing ladders every day,
Mm-hmm.
and this happened one day just like that. 99% closed. with a maker.
Almost lost him. How much, what about fibrinogen? How does that factor into the whole stuff that's in your blood that clogs it up?
Oh gosh, I wouldn't even know where to start with it. Not my study forte.
Okay.
I would gladly look it up for you, but
His is high.
Yeah.
I was asking, that nattokinase is
Mhm.
actually helpful for that. That's all.
yeah, I would have to look into that.
What about heredity and high blood pressure and high cholesterol?
Heredity is like a loaded gun. It doesn't hurt you unless you pull the trigger. You know, there's I love in the bathroom back there in the men's bathroom. It says hereditary is nothing but stored environment. In other words, you can take somebody from the American culture and move them into the Okinawan culture, and their life expectancy and disease risk factors will stop being American and will start lining up with Okinawans. You can take an Okinawan, pull them out of their society, move them into America, and they'll die of the same heart disease and cancer. So it really has very little to do with actual heredity. In fact, the human the human genome has changed. I covered this in another workshop. It's changed like less than 0.0001% over the entire lifespan that we can measure. Like, you know, however long that is, the earliest remains that we have, that's it. It hasn't changed at all. So how can everything all of a sudden be genetic when we've gone, you know, in literally a matter of 100 years from not having these problems to all of a sudden everybody having genetic issues? And there's one answer for it. It's called epigenetics, which means above the genes. And what the research is finding now is that genes are actually turned on and off. Everybody has the genes, but it's a matter of turning them on and off based on your lifestyle. So how do you fix it? You change your lifestyle, and your genetics don't matter anymore. Epigenetics override genetics every day of the week. That's good news for all of us.